China's added more people to health insurance than any other country in the world in the shortest amount of time. So there's a core dilemma in healthcare between providing care to everyone at super low cost and encouraging innovation, getting new surgeries, new pharmaceuticals, new approaches to treatment. And in the delivery of care, many countries have a mix of public and private, of government-backed and of fully private, profit-driven organizations. In the insurance side, very few countries maintain in a stable way both public and private. Many countries have fully public systems. Some countries have a mix, but if so, it tends to be unstable and there's a lot of tension back and forth. After the founding of the People's Republic in 1949, China embarked in a direct orientation to public health. And so the focus was really on fighting communicable diseases, on providing very elementary but available care everywhere in the country, and really seeking a low-cost public access to a system. In the 1970s and 80s, as China began to open up its economy and build the special economic zones, the public health, the rural system, went through a decline. And instead, the focus turned more towards cities, towards urbanization, and people really had to self-insure. They had to save money and then pay directly for the care they got. That has certain advantages in health systems in that it drives costs down, it makes doctors responsive to the patient who's paying them, but it left people without insurance for any more expensive care. If you have cancer in a system like that, it's very hard to have saved enough money to care for it. And so it's really then in the last 10 years that China's moved back into having an insurance system, a baseline coverage that makes it possible for people to see doctors. At the same time, there still isn't a lot of private insurance or higher-end insurance for people to be able to get care for more expensive therapies. And healthcare is an unusual field compared to, say, having insurance on your automobile or insurance on your home, as healthcare expenses come in unpredictable points in your life, and they can be very high. And so it's hard, in fact, to save for it. And so insurance allows some redistribution, but the Chinese system isn't yet set up to really do that in a very efficient way. My sense is that China needs to undertake some additional steps to expand health insurance coverage. The government's in some real discussions around producing insurance for very high-end, more expensive care. That has a dilemma, of course, of possibly driving costs up. If you provide insurance above a certain threshold, costs will tend to rise to that threshold very quickly. So there's some risks associated with that. At the same time, as China sees an aging population, there's going to be more and more demand for healthcare. That gives China a great opportunity to provide better care and to be the home to great healthcare innovation, whether it's medical devices, diagnostics, pharmaceuticals, or even new approaches to surgery. And then China has an additional opportunity around traditional Chinese medicine. And the government's, in fact, investing a lot in developing TCM therapies, standardizing them, testing them through proper clinical trials, and then that may, in fact, become a new area of great innovation and business. China, thanks to its world-leading population just in size, but also because it's been making a lot of investments in information technology, in building new hospitals, in renovating the existing hospital infrastructure, China has a great opportunity to become a world leader in clinical trials. And this is a touchy subject because some countries, in India, in Eastern Europe, did clinical trials as an outsourcing project for some years for Western companies, but it raised a lot of ethical issues around use of the population, and it raised other tensions because the drugs, once tested and approved, often weren't sold in those countries at a price people could afford. And so you had people taking part in clinical trials who later on couldn't, in fact, even afford the drug. And if you're talking about a chronic disease, you've basically provided treatment for the time period they're in the trial and then cut them off afterwards. And so that's not a situation you want to have develop in China. It is very important that China develop a good set of policies and enforcement mechanisms to make sure the clinical trials are done ethically and that there is a sufficient degree of oversight. And you can't do that inexpensively. And so I don't think China should pitch itself as a cheap location for outsourcing trials, but rather as having the world's biggest population, a future market, and a place where companies want to come and do trials in the most advanced way possible. Again, related to China's large population size, you have an opportunity to build electronic medical records and electronic health systems that compile patient data across this population. And then you would actually be able to find out in a more successful way, what are the optimal forms of care? So I think the single most striking achievement is the expansion of health insurance from something on the order of 70 to 75% of the population to almost 100% today. And to have done that across a population of 1.3 billion in the space of less than 10 years is an amazing achievement. The United States has a lower total insurance coverage rate and has been fighting about this for over 100 years, and China was able to do it in less than a decade. So that's a striking development. The second significant achievement I see in China is to become so attractive as a location for pharmaceutical, medical device, and diagnostic testing research. All of this, of course, raises some tensions, which is to say, every country has to make a choice, ultimately. Do you spend the money on research? It is, at some level, a luxury good. And the way you incentivize research, especially in the pharmaceutical industry, but also in medical devices and diagnostics, the traditional incentive was to give a monopoly right once the product is found, discovered, tested, and on market. And it's a little uncomfortable for developing countries to give monopoly rights, because then what you're basically saying is, okay, you discover this drug, you can now price it at a point that 5% of the population can afford. And if you don't have a broad insurance system to cover it, you've basically allowed a small number of people access to the drug, with some understanding that 20 years from now, when the patent expires, it'll be widely available. Well, that's a very uncomfortable position in public policy to take that stance. And quite frankly, most countries hide the choice. The debate shifts into other areas because it's a very uncomfortable thing to debate in a public and open way. And I think China is in some ways at a fulcrum point of needing to make some decisions around this. So far, they appear to be deciding towards research, towards supporting the sciences. But how long that's sustained is open to debate, discussion, and we'll have to track it and see.